Today's VETgirl podcast is sponsored by Antech. As a veterinary professional, you deserve a choice. Now you have it with Antech. Experience North America's largest reference laboratory network, comprehensive in-house analyzers and solutions, the most trusted diagnostic imaging equipment, advanced telemedicine and AI-powered solutions, and the flexibility to practice medicine your way. Smarter diagnostics, better care, all from Antech. Hi, VETgirl here today, and super excited to speak with Dr. Holly Brown. Today, we're going to be talking about in-house diagnostics and what you need to know. But before we begin, I'm going to turn it over to Dr. Brown. Holly, thank you so much for joining us for today's VETgirl podcast.
Thank you for having me, Justine. So my name's Holly Brown. I'm a clinical pathologist. I did my training at the University of Georgia. After I received my DVM, I went to small animal practice in Colorado for a few years. General practice is really hard and really demanding, right? Trying to be good at everything. I returned to Georgia to specialize, right? To pare down what I was responsible for. I did a residency in clinical pathology. I stayed on and did my PhD there as well, and then stayed on in a faculty position there for the first part of my career. And I still loved veterinary practice. I still practiced on Saturday mornings throughout my residency and my doctoral studies, and even when I was a faculty member, because I just love still small animal practice. But then almost 11 years ago, our family relocated. So we moved up to central Pennsylvania, and I ended up joining a large general referral and emergency hospital as an on-staff clinical pathologist. So a pretty unique position for my specialty, right? Where the majority of our diplomats are going to be at the reference lab setting, or they're in the veterinary teaching hospitals, right? Associated with the labs and supporting them. But for me, a really unique opportunity to be so close to the cases, right? To look at the lab data and look at the nuances around that, right? Look at changes in response to treatments or complications, help educate the team there, the veterinarians and the technicians, right? As the lab is, of course, a very shared space between veterinarians and technicians. And then I joined Antech over 2 years ago as their chief veterinary educator to sort of continue that conversation around maximizing laboratory diagnostics, but delivering it to our clients.
Love it. I have to say that clinic was so lucky to have you as an on-staff clinical pathologist. It is so nice to be able to run down the hall and be like, what is this on cytology?
Yeah.
So absolutely love that. Now, tell me about your experience in your current role as chief veterinary educator for Antech.
Yeah, so really lucky to join a team of other veterinary specialists that really focus on trying to help our clients, our customers, the veterinarians and technicians, maximize their diagnostic testing, right? So my area of most exposure and expertise will be around in-house testing, but I collaborate with others who focus largely on vector-borne diseases, other infectious diseases, or microbiology, right, in that field, or a wide variety of different specialists that are part of a team. And to get to be the chief educator just means I get to spend a lot of time right in front of our customers, right, and collaborating with them and trying to help them get the most of their tests.
Love it. As a clinical pathologist coming from UGA, Go Dogs, from the University Veterinary Teaching Hospital and the Associated University Lab, I wanted to ask you what your feelings were about what I'm going to call point of care testing. A lot of people call it point of care testing or POC or in-house diagnostics. And just so you know, those of you guys who have worked with me, you know I'm the queen of abbreviations. So I'm going to actually call it IHD or in-house diagnostics for the rest of the podcast. What are your feelings
Well,
about it?
yeah, it was a real change, right? So coming from the veterinary teaching hospital and having the reference lab there and having reference lab analyzers and then trained medical laboratory technicians, right, that did all of that sample processing for me. And I was handed like a finished product to review, right? And then I joined the practice and all of a sudden I was handed samples. I was working with the technicians in the lab on those analyzers, right? And looking at those results, right? So it was a big transition and I was blown away. I was shocked to see that a lot of the really high and expertise in the technology that we have that built our reference lab analyzers are also available in those small benchtop boxes, right, that we run for in-clinic testing. So I actually really bred my confidence in using these analyzers and using them next to the patients, right? So I was looking at the data right next to the patients, and I feel like that gave me a real leg up, right, in making consultations and recommendations, but also then to learn about the analyzer and getting that feedback from the patient, right, to believe in the data that I was getting.
Love it. I absolutely love it. I remember I used to work with a clinical pathologist right down the hallway, and I always appreciated being able to run a sample from surgery down for stat cytology. And again, just being able to have that collaboration is so, so helpful. And I would say, a lot of the clinics that I've always worked at always had IHD analyzers. Again, the point of care, the in-house. But that's also because I'm a criticalist and we're super impatient and we want all our test results in less than 5 minutes. All right. So I did want to talk to you about how that IHD could affect communication or conversations with our pet owners during appointments.
Yeah, so I think something I came to really value in the clinic setting, right, was being able to show our pet parents some of their results, right? So no longer if we are maximizing our point of care testing, our in-house diagnostics, when relevant for the case, when appropriate for turnaround time, there may be a clinical demand to get information sooner for the patient or a parent demand, right, to get that information for their pet. And we're able to give those in-time diagnostic results to our patients. We really get to show the value of that, right, to the owner, right? We're not expecting them when they're checking out to pay for a bill that includes diagnostic tests that they haven't even seen yet. Right. And I think that a lot of times when we have reference lab results that we get back the next day, when we call the client, right, we tend to minimize that whole clinical picture that we're getting from that lab work because we don't have time, right, on the telephone call, right? And they can't see what we're looking at. And so we might say something like, oh, the kidney values look good, no sign of anemia, and I feel good about where the inflammation's going, or something like that. But when we get to show them the test results, right, we can go through the CBC and we can show them that high-end technology, right, that goes behind those numbers, right? And then we go through the chemistry panel and we show them all the different organ systems that we have evaluated, whether they're normal or abnormal, right? In those cases, I feel like we then get them on board with the value of those diagnostic results. And often it leads to easier conversations of next steps, right? We have the pet there, we have the pet parent there, they see the value in this testing, they hear the concerns that we're seeing around inflammation, let's say, right? And next tests are often common imaging, right? That will go to imaging next because we want to find the source of that inflammation or why the red cells are being shorn or why we have the thrombocytopenia or the atypical lymphocytes, right? And so I think it does facilitate and communicate that value in the testing when we have those in-time results, which really helps, right? And often it's that in-clinic testing that leads to further diagnostic tests that often rely on the reference lab, right? We know having them paired together, it's not an either or situation, right? We don't run tests just in-house or just at the reference lab, right? They're very complementary, but sometimes getting those initial in-time diagnostics then lead to the more advanced diagnostics that we're going to request from the reference lab.
I also think it helps with communication with our referring vets. Coming from a specialty clinic, I oftentimes would get referrals. And I will say my general philosophy as a veterinarian is treat each pet the way you would if it was your own pet. And I always tell pet owners, you should always, if you paid for it, you should get a copy of the blood work, right? And I used to have this referring vet that I worked with, a mile from the specialty clinic. And I always appreciated the fact that he sent his owners with the printed blood work and he'd always circle and say kidney, or he'd circle, all the liver enzymes and be like liver. And I always appreciated that because it showed the owner something tangible, right? They paid for it. They want the copy of the blood work. It's really helpful for me to have that because it's going to take an hour before it's faxed over. So it also helps the conversation. It helps the owner feel like they got what they paid for.
Really is engagement, right? So, right, you get them
Exactly.
engaged in that process. And even around wellness testing, right? Even when we expect the results to be normal, right? If we can spend that time with them to show them everything that we tested, right? Get them invested in that process of getting some baseline data for their patients, right? And go through that so then they could trend it. Then the next year or 6 months later, when we're getting our next trended value, right? We can go through that with them. We get these owners really tuned in to the health of their patient, what that looks like in their laboratory work. And then when they do come in ADR 6, something's going on, they know the value in getting those additional tests, right, to look for those abnormalities.
Exactly. And my general philosophy is, if it's a 10-year-old dog, I actually advocate that they do the routine blood work, the geriatric screening, instead of, X, Y, or Z vaccine, just so we can monitor things like that. I remember, granted, this was 20 years ago, I am still a huge believer in what I call the big four or QUATs, the big four being PCV, total solids, blood glucose, azo, or the quick assessment tests. And, it's super old school to use the azo sticks, but I remember having a 2-year-old young Labrador come in, just, vomiting a couple of times. Dog was barely dehydrated. And I offered them just doing the PCV, total solids, blood glucose, azo, versus having to call in ClinPath to run the blood samples because we didn't have IHD right on the counter. And the owners elected for just the big four and would wait for the blood tests. And I remember in that scenario just being shocked as a criticalist because this dog was wagging his tail, happy. And the azo stick was just barely 50 to 80. So I was like, yeah, it could be prerenal, got some sub-Q fluid, some antiemetics. And I remember having to call him the next morning and be like, your dog's BUN is 222, and I need you to come
Oh,
back in ASAP, right? Because it doesn't like get darker. It just says 50 to 80 on an azo stick. So again, reiterates the importance of having that option for in-house diagnostics. Do you mind sharing a recent case that highlights the value of having that option?
yeah. And so the case I'll talk about, and I got a chance to present this recently on a VETgirl webinar, which we can talk about, but is looking at the vomiting dog, right? So it's such a typical common presentation, right? Rex is actually a patient that we were able to highlight in the Antic booth experience at VMX and will be at Western this year as well. And Rex came in with a history of a week previously. He had been eating one of his toys. He had torn apart some of the fabric of it. The owner couldn't recover all of it. And he was concerned he had swallowed some of it. In addition, a couple of days later, he did have some episodes of vomiting. Dad had gone to his regular veterinarian. They had talked about the history, his concern for this foreign body ingestion, but the dog was still eating. He was holding some of his food down. He was non-painful, non-febrile, and they elected conservative treatment. So together they talked about the options and they elected to just treat with an antiemetic, some gastric protectants, and some sub-Q fluids. And he did well for another couple of days, but then the vomiting returned. And so the owner was concerned. And now it's a Saturday afternoon, right? So now he's arrived at our practice. And so we get a Saturday afternoon. We have a very concerned owner and he is vomiting again. We need to get some answers, right? And there's that always that common scenario of trying to pick and choose and engaging the client in the conversation around options, right? And we say we can look at lab work, right? We can do lab work and look for signs of inflammation. We can rule in or out other causes of vomiting aside from the toy that he may have ingested, right, earlier in the week. Or we can go to imaging, right? We can actually look for the toy in there. We can look if it's causing a problem. And Dad elected to start with looking at the lab work because we get maybe a more holistic picture, right, of the patient, and we don't just hone in on foreign body, no foreign body. In looking at that lab work, the first results we got back was the CBC, and I love the CBC as the first test, right, because it's a really sensitive test of health versus disease, right? It may not tell you where it is or what exactly is going on, but looking for signs of anemia or inflammation or a thrombocytopenia, right, can hone you into saying, yes, there is a problem. And in this case, they did recognize an inflammatory leukogram, right? So something really was significant with Rex, associated with his vomiting, that we're seeing inflammation. We have trouble in veterinary medicine in actually being able to quantitate that inflammation, right? So we look for numbers of bands, but there's so much subjectivity there. We use our automated analyzer, which sometimes can give us the picture of bands with our in-house diagnostics, right? We can use those cytograms, which I love on our CBC that can actually visualize some of those bands in there. But in addition, something I think that's really underutilized, but perhaps you would see the value in is looking at CRP. So looking at the acute phase proteins, because in dogs with systemic inflammation, CRP can actually quantitate that inflammatory response for us, right? So they did also add on a CRP measurement in the dog, which was also elevated. And that's not just any inflammation, but systemic inflammatory disease, right? So now we're having been further concerned that maybe this foreign body ingestion has caused further disease. Fortunately, everything looked good through his chemistry panel, no other organ dysfunction or concerns there. After reviewing those results with the owner, right, we're starting down this diagnostic pathway. We started with the CBC. We shared the concern around inflammation. We tacked on the CRP. We're also able to do that at point of care, right? So at our practice and where we ran this lab work, we're using the Element I Plus that has a CRP for it. We got our lab work off of our hematology analyzer, in this case, the HT5. And then we showed them those results. We went through the CRP. We get more concerns around the lab work, right, and the inflammation. So we said next, probably imaging, right? So this is a solo practitioner, one of our younger doctors at the hospital says, I'd like to see a picture. You know, they take 3 views of the abdomen, and she is concerned about some of the gas patterns. Now, they weren't obstructive overtly, right? They were just irregular, and she thought she could see some foreign material in there. But it can be challenging, certainly as a solo practitioner, and looking at these radiographs, Dad's really trying to figure out, like, do I cut or not cut? right? That's the question with these foreign bodies. Like, is it necessary? And she couldn't say with confidence that it was, right? Without seeing that overt obstruction. We know there's inflammation. We know there's a problem, but she did reach out to the specialists, right? We're really lucky in practice that we can bring this expertise in-house, right? Bring it in clinic by reaching out to the radiologist, in this case at Antec Imaging Services. She had those radiographs reviewed. They looked at the radiographs together. She got some feedback that said, yes, they are concerned about the foreign material in there. They do think that there's some plication of the intestines, right? They're also concerned about the gas patterns, and they did recommend a surgical explorer. And that was just the confidence that she needed, right? So she built her layers of support and engaged the owner through that diagnostic process where they started with the CBC, they looked at organ function of the chemistry, they added that CRP to quantitate that inflammation. That raised enough red flags that they went to the imaging. She showed him the concerns. He was on board, but she couldn't say with confidence that it needed to be cut, right? So reached out to the specialty, have the radiologist give the weigh in, say, yes, surgery is indicated. You should explore. And it gave her that confidence to know what she's going to find when she gets in there too, right? Not only was she not expecting a negative explorer, she knew she'd get value in going in there, that the patient warranted it, but understanding that she's looking for that area of plication and that foreign material and where it was in the small intestine. Successful outcome, a pretty extensive RNA resection and anastomosis because of the plication that had occurred in there and some of the destruction of the bowel, but ultimately a very successful outcome.
That's awesome. Love to hear. And thank you so much for sharing that. It's always nice to have that lifeline, right? So I love
Absolutely.
that. Now, I did want to talk to you about how might the use of in-house diagnostics or IHD affect workflow in clinic? And I can tell you from having practiced at a very busy emergency practice and specialty practice, we actually had to allocate one dedicated lab personnel, one technician to just run diagnostics because they were so bombarded. They're getting, 50 samples from, in-house patients, ER patients, outpatient. So it can be overwhelming, but how can it help with workflow?
Yeah, so I do think we have to engage our technicians, right? So this is exactly where they can shine, right? Is empowering them around the lab work. And in particular, assigning, depending on how much in clinic testing is done, assigning one person as the primary contact there, right? Because they know the analyzers the best, right? We know it's not the doctors, right? We know it's the technicians that learn the analyzers the best and are responsible for the data that comes out of that lab, right? So it does sometimes change the workflow of a hospital when they have to run testing in clinic, right? But it really maximizes our support staff, right? And it elevates the technicians to the level that we want to have them practice at the height of their certification, right? And so running that lab work and feeling confident around them, also, it gives them the opportunity. I think that historically, maybe technicians that go in the lab to just do fecal tests or ear swabs or something, so underutilized, right? But when they start getting engaged in the CBC results or learning those cytograms or what the chemistry values mean, right? It gives a lot more relevance to the case, and they actually feel clinically connected to the case when they understand the lab work more. So I'm such a big believer of teaming up the veterinarians, with the staff members, the veterinarians and the assistants who are going to be running the lab work, reviewing the results with them, right? So they feel empowered about that as well. And then also sometimes frees up, especially around normal findings, maybe the technicians can go in the room and show those results to the owners. Right. So I think engaging our support staff and our technicians in the lab in particular can make that flow a lot better.
I absolutely love that. I've had multiple amazing veterinary technicians that I worked with who would pull me over for cytology. I'm like, no, you're better at this than me. I don't know. So yeah, absolutely. Empowering your amazing staff out there. All right. Now, I did want to ask, now that we know what it can do for our workflow, how it can help with our client communication, with our pet owners, also with our referring vets, how does Antec add expertise around in-house diagnostics to hospital labs?
Yeah. So, and I will broaden in-house diagnostics to include imaging as well, right? So around the lab, certainly one of my roles, right, is to educate. Right. So as we think about providing in-clinic testing, Antec is now so proud to be offering a breadth of diagnostics, right? Everything that was already historically offered at the reference lab. But now with the acquisition of HESCA, right, we have the HESCA in-clinic suite as well to be offering to widen those diagnostic options. And so, of course, one of the things I'm charged with as the chief veterinary educator is to come behind some of that, right, and be able to offer education more widespread to help our clinicians get the most value from those analyzers and that data. We have the amazing team of clinical pathologists at Antech. We have access to them through cytologic samples that can be scanned on the Heska view, right? So now is, and certainly you had this experience as well, I'm sure, in the emergency setting, is that, being able to scan a blood film or scan a cytology and get results back from this expert within a couple hours, right, can really help dictate how a case is handled, right, and keep us working through a critical case in a timely manner. And then we have the imaging support as well, right? So we're really fortunate to have the team of radiologists at Antech Imaging Services that are readily able to review radiographs. They can review images, either loops or still images from ultrasound as well. And they've also developed that AI. So there's rapid read, right, on the radiographs, right, is developed by the board certified radiologist. It brings that expertise into the clinic, right? Where now you can have radiographs reviewed with the AI, right? Adding that specialization, right? That specialty trained tool to give them feedback on their radiographs. So all these tools that we are trying to do to help support, right, our veterinary teams in practice around all their diagnostics.
Awesome. Great, great information. Again, I always love having a lifeline and really appreciate that. Now, as our audience knows, VETgirl is generously supporting the VETgirl Diagnostic Imaging Certificate, which is complimentary till the end of the year 2025. And first of all, I just want to thank you for being an awesome educational partner. I know you gave the webinar in the beginning of the year in January, Diagnostic Essentials for the Vomiting Dog. Again, that case example you talked about, which is so important because every single patient we see come in is vomiting, right? Can you tell us about your webinar, Diagnostic Essentials for the Vomiting Dog, that's part of the certificate?
Yeah, that gave me a really neat opportunity to team up with a radiologist, right? To look at our breadth of offerings around diagnostics and how we work through them as clinicians and as veterinary team members, because it is such a common clinical presentation, right? So it was really a pleasure to work with Diane Wilson, Dr. Diane Wilson, a radiologist at Antech Imaging Services, and look through cases. We each brought different cases to the table. We complemented me looking through the lab work as the clinical pathologist and her looking through the imaging. And it's such a treat, as you know, you do plenty of webinars yourselves, like to learn during your own webinar is such a treat, right? So for me, I was doing the laboratory part, right? And trying to support how a clinician is going to work through the significance or the implications of the vomiting patient, right? What we're going to look for signs of inflammation, right? Really can be hard to detect, right? Clinically. And so we look at lab work, trying to get some objective information and identifying inflammation, that significance, or looking through the chemistry, right? To see if we have any metabolic disease underlying that vomiting, or are there any, are we losing proteins because of that vomiting? Or there's a whole interplay we have there of the lab work, right? That I was able to discuss with those cases. And then paired with Dr. Diane Wilson, the radiologist, who's then saying, these findings on the lab work drove us to imaging, right? On imaging, I was able to see this XYZ to explain the changes we were seeing in the lab work and what the outcomes of those cases were. So I think they're all really common cases that we see in practice. I think it's a fun webinar to listen to and challenge yourself, right? Do you see the same changes in the lab work? Do you see those same changes on the radiographs? And a fun one for me to bridge the lab with the imaging diagnostics.
Love it. And again, everyone's welcome to watch that. It's free until the very end of the year for 2025. And that's actually my favorite webinar because to cut or not to cut is a really difficult decision when you're in the clinic by yourself or you're staring at the radiographs with another colleague. You're like, and you're not 100% positive. So great webinar. You definitely want to check out. Dr. Brown, thank you so much for all that you do. Love being an educational partner with you and just really appreciate your passion for education. Thank you so much.
Thank you so much, Justine.